Good evening, everyone, and welcome to today's asthma webinar hosted by Black Health Matters. My name is Dr. Patricia St. Cyr Hager. I'm the Chief Operations Officer for the organization. Thank you all for joining for this important conversation focused on asthma awareness, education, and advocacy, and support within the African American community. Just a few housekeeping notes before we get started. We're going to be recording, and there is photography in progress. So wanted to make sure you're aware of that. And that's so that we have content that can be shared with many others who weren't able to attend today. We also encourage everyone to complete the pre and post survey. So while I'm talking, you can scan the QR code that's on the screen. This is important. It helps us understand what you've learned, your interest areas, and helps us shape how you can continue to participate or others in the community moving forward. So I'll just pause for a moment to allow you to scan the QR code and complete the survey. It's really short and simple. During the meeting today, you'll be able to also post your questions. So I'll come back to that, but you'll be able to use the Q&A area. That should be an icon on the bottom of your screen, or for some of you, you may have moved it somewhere else, where you'll be able to post your questions, and we will get to Q&A with these fantastic presenters today. We would not be able to make this event possible without our sponsors. So we want to thank our sponsors, and partners. This was supported by a Sanofi Regeneron grant. So thank you so much for that. And we're working in partnership with the organizations that you see to the right. And thank you so much for your partnership. They're contributing to by having people attend as well as to the content. Today's discussion is centered around a simple but powerful truth. If you can't breathe, nothing else matters. Asthma continues to disproportionately impact Black communities. And through today's discussion, we hope to provide education, resources, and some real life experiences that empower individuals and families to better understand and manage asthma. We have two fantastic speakers that you're going to hear from. Dr. MORA, who will guide us through the medical realities, disparities, and management strategies related to asthma that still exists today that we need to counter. And she has a great set of content for us to hear about how to counter some of the challenges. And LAONIS, QUINN, who will share her family's personal journey navigating asthma and advocacy. We're super excited to hear from both of them. With that, I'll now turn it over to Dr. MORA, and I'll be back later for Q&A. Thank you so much.
Thank you so much for Patricia for having me today in Black Health Matters. And thank you everyone for joining us tonight. It is such an honor to be able to speak with everyone today. And the reason we're speaking about asthma is because it affects 28 million people in the United States. When we're talking asthma, it disproportionately affects the Black community. When we talk the Black community from 2019 to 2021, an estimated 4.2 million non-Hispanic Black Americans in the US were living with asthma. Black Americans are disproportionately affected, with roughly 1 out of 10 Black adults having the condition. Black children are being more likely to have asthma than any other race in America. And 11.6% of Black children, representing more than 1 million children nationwide, live with asthma. I also have to mention that in the United States, 11 people die from asthma every day, which is why we are completely here to see what we can do to really help these healthcare disparities. Next slide, please. When we talk the reality for Black patients, Black children are 60% more likely to have asthma than white children. And Black adults are nearly 1.5 times more likely to be diagnosed than any other group. Black Americans are 5 times more likely to visit an emergency department for asthma. And Black adults are more than twice likely to die from asthma. And in 2020, Black children were 7.6 times more likely to die from asthma-related causes than white children. Black children in the US have the highest rates of asthma, with some inner city, low-income areas seeing prevalence rates near 20%. Next slide, please. And these are some of the triggers that I like to teach my own patients when it comes to asthma. These are allergic triggers in asthma. One is pet dander. We all have those patients, and in our homes, we have those little pets that trigger our asthma. Cats, dogs, hamsters, birds. And inside the home, we have dust mites and cockroaches. Number one trigger for dust mite allergy in a home, those stuffed animals that kids love to have, and carpeting. So two things that I always tell people to clear from their home. Secondhand smoke is a huge trigger for asthma. It contains more than 4,000 substances, over 40 are carcinogenic. In particularly harmful for children because their lungs are still developing. Those airways are more vulnerable to wheeze and have asthma exacerbations. And it can definitely trigger asthma attacks and cause young children to develop asthma. I'm also seeing it as an allergist in immunology in kids who are exposed not only to regular cigarette smoke, but also vaping and also marijuana smoke. So things to definitely think about. When we're talking outdoor triggers, we're living in spring right now. So tons of pollen, trees which are spring, grass which is summer, weeds which are fall. And there's something called allergic asthma where the pollen just hits the smallest areas and causes inflammation. We also know that outdoors, especially in areas like California, we've had them in New Jersey, Canada, we had wildfires. That promotes a lot of particulate matter in the air. That's a huge trigger for asthma exacerbations. Sulfur dioxide in the air as well, too. Nitrogen dioxide and vehicle exhaust. Outdoor pollens like trees, grass, summer, and ragweed and weeds, which he told them. And as well, too, we also have mold indoors and outdoors as well, too. Next slide, please. We also have to look at additional asthma trigger. So those include viral upper respiratory infections. So there's the kid that every time they catch a cold, they have an asthma exacerbation. So that is one of the actual big triggers that we have. And the other thing is exercise. So a lot of kids and adults who have problem when they exercise. And so they have wheezing or coughing or shortness of breath. Then there's aggravating conditions that can contribute to asthma as well too. So for example, reflux, sinuses, especially sinus infections when they drip right into the lungs, because we have to remember it's one actual airway from the sinuses to the lungs. And rhinitis, just allergic triggers as well too. Diet and some medications can also cause drippage right into the lungs. Cold air exposure or hot air exposure. Remember, lungs are our most vulnerable organ. So actual changes in temperature can be very hard for kids and adults with asthma. So going from heat to cold or cold to heat can definitely promote an asthma exacerbation. And that's where the changes in weather. Menstrual cycle and pregnancy. Aren't we lucky as women? So one of the things we see is very hormonal shifts. So we know as girls get their period and they have asthma, we often see asthma exacerbations along with when girls get pregnant as well too. And then comes menopause, which is another asthma trigger as well too. Next slide, please. Now we have to look about asthma symptoms that are often overlooked. So for example, a chronic dry cough that doesn't seem to go away. A cough that awakens that child or that adult at night frequently. a cough that worsens with weather changes or allergies, a cough that lasts forever after a cold, the deterioration in quality of life that occurs when people stop exercising or doing things they enjoy because of asthma symptoms. They experience shortness of breath, wheezing, cough, and think that they're always sick. And they stop doing things they like. So, for example, in my patients, I often see they don't want to go to church, they don't want to travel, they don't go to their graduation party because their asthma is stopping them from it. And we can't let asthma control our lives. We have to control our asthma. Next slide, please. Now, in the African American community, there's a lot of barriers to care. One is lack of access to healthcare. When we're talking lack of access to healthcare, we know, especially under different administrations that we've had in the United States, sometimes people lose insurance and are not given the benefits. So one is the loss of medical insurance in kids and adults. Two, lack of access to pulmonologists or allergists and immunologists for better care of asthma or more advanced care of asthma. Three, mistrust in the medical system, and this comes from history. So it's learning to give trusted messengers and trusted doctors into the community to help patients do better. Lack of medical insurance, like I said, inflexible work schedule, for example, lack of childcare, or sometimes the specialists don't have actual Saturday hours. So, as a Latina in Chicago who sees a lot of African American and Latino community, I open every single Saturday in clinic, 8:30 to 1 o'clock, because I know my audience. This is a time when kids don't have to miss school, parents don't have to miss work, and it's accessibility so that people can come and get their treatment. And then lack of transportation, because sometimes a specialist like an allergist or a pulmonologist might take hours to get to because the nearest one might be an hour away or 2 hours away. So dealing with this might be a barriers to care. So making more virtual visits, as we'll talk about, making actual specialists more accessible as well too is going to be helpful. And then the lack of affordable medications, especially if we don't have insurance, that's where it definitely, the cost effectiveness of medications, for some people, it's putting food at their table or affording these inhalers. And obviously here in the United States, a lot of our advocacy work has been into making inhalers and asthma medications, especially rescue medications, at a good price. So that way people can afford it, because absolutely, if you can't breathe, nothing else matters. Next slide, please. So expanding access to care is definitely a key point that we want to do as doctors, as nurses, as respiratory therapists. It takes a village, they said, and this is completely true. So expanding access to respiratory specialists involves a multi-pronged approach that leverages technology, legislative reform, and expansion of clinical networks to bridge gaps in care, particularly in rural and underserved areas. Number one is telemedicine and virtual specialists or allergists and immunologists or pulmonologist access. So programs like the VA telepulmonology connect patients to respiratory therapists and pulmonologists via secure video conferencing that effectively removes travel barriers. That's going to be so important for patients to get the care that they need without leaving their home. Two, remote patient monitoring programs. These are AI. We're using AI now in trying to break down some of these barriers. So AI-powered wearable sensors that allow for continuous monitoring of lung function and oxygen levels from home, enabling timely interventions and reducing the need for hospital visits. And then the third one, which is becoming one of my most favorites, is remote robotic respiratory therapy. So it's a new platform that combines robotics and AI to deliver personalized therapy protocols to patients in their homes, specifically targeting those with mobility or resource constraints. As I think, especially of my older patients or maybe children with mobility issues, this is such an important program. Next slide, please. We also want good access to respiratory care. And this is where programs like the hub and spoke models, this model connects specialists with healthcare professionals in primary and community settings, extending clinical capacity to local community hubs. So this I see a lot, especially, obviously I do this in trying to get to some of the areas that might not have an allergist or a pulmonologist close to them. And I'll serve for the primary cares as maybe one of the actual someone who can give them advice while they get into it to someone close to them, or they get into me, etc. So that way we form a network, which is so important. The second one is lung health navigators. I work very closely with the American Lung Association, and this program is actually organized by the American Lung Association. And it offers personalized guidance through Zoom or phone, connecting families with expert resources. So this is a wonderful one, and people can go to lung.org, lung.org, to learn more about this program. The third one is the Breathe Act. It's a proposed legislation that aims to allow respiratory therapists to be recognized as qualified Medicare telehealth practitioners, enabling them to provide home-based care. So these are all wonderful legislations and things that we're doing to break down barriers. Next slide, please. And as we look at, with the Allergy and Asthma Network, we have developed a wonderful PSA on asthma that is geared towards getting to underserved communities like the Black and Brown communities in the United States. And this is the questionnaire that we put up on this website. We have an asthma coach. The actual website, which I'll introduce in a few minutes, it's called controlyourasthma.org or controlartuasma.org. We have done it in English and Spanish. And it basically says, let's recognize symptoms for hard to control asthma, the rules of two. So the rules of two questionnaire should prompt recognition of uncontrolled asthma. So for example, first question is, have you used your rescue inhaler more than twice a week? Nighttime awakenings due to asthma more than twice a month? Has your asthma sent you to the emergency department or hospital in the last year? Have you been prescribed steroids in a liquid, pill, or injectable form more than twice in the last year? Have you refilled your rescue inhaler more than 2 times in the last year? If you answered yes to any of these, it's time to see an allergist, immunologist, or a pulmonologist, because we want to get that asthma under good control. Next slide, please. There's a lot of wonderful, as an allergist and immunologist, I can tell you there's a wonderful change in the landscape of respiratory disease. Now we have advanced medications. One is individualized plan and targeted therapies. So before, asthma used to be about just inhalers. Everyone got the same inhalers. Let's control asthma, etc. But now we actually draw blood and try to see what type of asthma you have. Is it a cell that's more common in you called a eosinophil, that's called eosinophilic asthma, or is it more allergic asthma? That's the first determination that we make. Second is, do you have severe or moderate asthma or mild asthma? And then we also then can plan on a biologic. Biologics are injectable medications that are now prescribed for asthma. Some are every 2 weeks, some are once a month, some are every 6 months. There's a new biologic for asthma that's every 6 months. Ultra long duration asthma therapy. So is the landscape changing? Absolutely. And it's very exciting. There's also new guidelines for rescue inhalers. So we no longer just use albuterol alone, especially in people 18 years and over. We now use a combination inhaler that treats not only the underlying basically bronchoconstriction or airways closing, but it also the obstruction that's there, but we also take care of the inflammation in the airways, because asthma is 2 things. It's inflammation and obstruction in the airways. There's also new triple therapy inhalers for the control of asthma. So it's not just the inhaled steroid plus the long-acting albuterol, but now they have another medication that helps break down the mucus a little bit better, that really gets into the lungs. And like I said, new biologics that target the pathway of asthma triggers and that include injectable medications for asthma. We also have new digital inhalers that track how often they're being used and when patients need to seek help. As an allergist, I love for patients to bring their inhaler in, and then I can see how many times have you used your rescue inhaler. I can actually see the number on the actual inhaler, or also their controller inhaler. I can see, hey, Has Johnny been taking his inhaler? Let me take a look. When I see the canister is full and they're supposed to have taken it every day, every month, I can have a talk with them and say, okay, let's talk compliance. So it really creates a dialogue and partnership, shared decision making when it comes to asthma control. Next slide, please. And as I was telling you, innovation in digital health. Welcome to 2026. It's a beautiful thing. We have digital inhalers, like I said, devices that track and usage and technique in real time. So it allows us to know, is the patient taking a deep breath in? Is the actual medication getting down to the lungs? And are they using it? So that way we can review it, and they're connected to apps on the phone, because in 2026, these kids know how to use these apps better than any of us. So we got to keep up with their times as well too. And new delivery methods, like I said, moving towards ultra long acting biologics dosed every 6 months. Next slide, please. The other thing I have for every single patient is an asthma action plan, because it's so important, because I want my patients, little or adult, to know what medications they should be taking every day, what medications are rescue only, and when is it time to head to the emergency department or to the hospital if their asthma is really acting bad. So it's really teaching them to learn their asthma and to know what to do. So for example, the green zone is where everything's going well. There's no shortness of breath, no wheezing. People are feeling really great. And then we ask them to actually take their medications every day. So this is where I write down the inhaler that they take every day. They're supposed to do 2 puffs in the morning, 2 puffs at night. And then I also put here whether they should use it for exercise, their rescue inhaler. Maybe they need to do 2 puffs 10 minutes before starting exercise, or they use it when they're going to go outdoors to the barn or be exposed to farm animals, etc. Yellow zone is suddenly they catch a cold or they're exposed to the allergic trigger. They're very allergic to cats, and suddenly they're exposed to cats at someone's home, etc. So they start having a little bit of wheezing or cough. This is where you write down what you want them to do. Sometimes we'll double up the inhaler that they take every day already for about 10 days, which is usually the duration of a cold, and we'll add the rescue inhaler as needed. And then the red zones, where we never want any kid or adult to be, which is where they're so short of breath, they're wheezing, they're coughing, they can't even get words out. So conversations are hard for them. So at that point, we want them to do 6 to 8 puffs of their rescue inhaler and call 911. But this is a plan that they should carry. They should have in the refrigerator of their kids, so parents know what to do. So this is what I walk them through, and we review it because it changes as they grow, or maybe they start a biologic, so they have an injectable medication that they take every 2 weeks, etc. Next slide, please. So now I want to invite, every patient has a story to tell. And I want to invite a wonderful, powerful woman who, more than anything, is a mother who's become a huge advocate at a national level. She is going to tell us the story of her son, that is a powerful story that will move hearts, and tell us why it's so important that we change what we're hearing today. We change the numbers and we save lives in the Black community. Let me welcome LAONIS QUINN.
Hello, everybody. So good to be here, Dr. Mora. Thank you for having me. To the audience, I hope this story uh, allows you to understand the significance of asthma.
LAONIS, tell us your story. Tell us Anthony's story.
Okay, so Anthony, my oldest son, call him Tony. We call him T-Bone because he loved T-bone steaks. So that was his nickname. We're diagnosed with asthma when he was about 2 years old. And I knew he had asthma because we would go to the emergency room quite frequently with the coughing and cold, runny nose. And finally, it took a few visits for them to say, okay, yeah, he has asthma. So at that point, we were referred to a allergist at Children's Hospital of Michigan. Is this wonderful woman took such good care of Tony for about 10 years, and she retired. She had a private practice, which we were there a lot. We were there a lot. Tony had severe asthma. And when she retired, we decided to stay at the same clinic because everybody knew Tony there. Tony was the regular little kid, come in spunky, and we decided to stay there. So, the story is a long story, but fast forward, as when Tony turned 21 years old at the time, I didn't know of his dad's healthcare insurance. I had no idea, not paying attention to those kind of things, and didn't know. We went to a well visit one day, and after the visit, went to the office to check out, to pay our monies, and they were said, well, this is Tony's last day here. Just like that, out the blue, no warning. No, you got 6 months to find somewhere else. No, you are just cut off. This is his last day. And I stood there in disbelief because I'm like, why nobody said anything before? Anything, just no warning, no heads up, just you can't come here anymore. So a lot of things happened at that very moment in my mind. What are we going to do? This kid is sick a lot. Who's going to take it? Where can we go with no insurance? So I did find a free clinic in our area. It was a really good place. The visit was a great visit. I'm thinking to myself, we're good here, Tony. You're going to have somewhere to go. But that was not the case. Was not the case because the doctor that saw him that day said, oh, by the way, we don't have a regular doctor on staff. So if he runs into trouble, emergency rooms is where you have to go. And that was our life for a year and a half. Emergency rooms twice a week. I would take him. My husband would take him. My other son would take him. It became a family ritual. When you have a kid with asthma, your whole family has it. It's no one sitting on the sideline looking to see what you can do next. It becomes like a well rehearsed movie. Like everybody do their parts. Okay, when Tony gets sick, this I'm gonna be doing this. Mom gonna get the car ready. Dad's gonna it become a well rehearsed movie. We did it so very often. And it went like that, even for myself when I'm an asthmatic myself. I had asthma. And it was the same way. Your whole household is up. Um, you don't rest, the stress level is quite high. And with Tony, it was the same way. And about a year into that, Tony, he had all kind of medications, the allergy shots, the pulmonology visits, the sleep studies. He had, think of he could have, he had it. It was no stone left unturned, especially when he well at the clinic there. But like I said, as time went on, and Tony would get these asthma attacks quite frequently. He told me, he said, "Mom, I'm tired of living like this." And I heard the words quite clearly, but I did not really internalize what he was saying to me. So I'm like, no, don't say that. Don't, you're going to be okay. You're going to be fine. So actually, I had went to try to apply for Medicaid, I should say Medicaid, disability. He was denied. Denied three. I tried 3 or 4 times on each thing. Denied, denied, denied. No, he lives at home with his parents. He's not on his own. He should be okay. But that was not the case. Even at the doctor's office, I even offered to pay. I'll pay you. I have a job, I have a career. I can pay you for the visits. Well, you won't be able to afford that, LAONIS, because you have to buy the medications and pay for office visits. So that was denied. Everything that I thought would work didn't. And on a cold February morning, I worked nights at Veterans Hospital. I've been a nurse for a very long time. Tony had been sick before I left that night. He didn't feel well. And, I'm like, go to the emergency room, Tony. I don't want to do that today, Mom. I'll be okay. So I went to work, heavy-hearted, thinking that I know he didn't feel well. So I was leaving work that one morning, and my youngest son called me. He was screaming like a girl. He was screaming like an eighth octave scream. I can hear it in my mind today. I can still hear it, the scream. And I started running. I'm running down the hallway to my car. And I said, Andre, stop that screaming. And he just continued to scream. And finally he said, Tony left us. And I heard that also. I heard it at the same time. Your mind. Tony had a degree in computer science. He went to school and to college. He worked. He had a job, but at the time he wasn't working because he got fired because he was absent all the time. So I'm thinking, I'm like, where did he go? I said, where did he go, Andre? Where did he go? He just started crying, crying. Tony passed away in his bed last night. So I still heard it, but they had called the EMS. Tony called EMS himself before he kind of passed out. He called them himself. They arrived at my house, took me to the emergency room. And one of my coworkers, I would always remember her, Victoria, took me to the hospital to see. I'm thinking Tony was just had a bad asthma attack, but that was not the case. Of course, I got there. Tony had passed away at home, so it was an eye opener for me. Very dark times for my family. I tried to commit suicide 3 times. Of course, I'm still here. I did not succeed. Thank God I didn't. But when and 6 months later, ironically, my husband had a stroke. He passed away the same year. So I lost my very best friend and God's gift to me in the same year. So with that, you cannot imagine um, the pain and trying to maneuver with that kind of loss, that kind of loss. So actually, we lost everything. I lost my home. I still kept my job, but we lost everything. And we had to start over from scratch. We started all over from scratch. And it was just me and my son, Andre. It was almost like us against the world. And actually, Andre saved my life. One day we were in our car, and I don't know where we was going somewhere. And I just started crying. I said, I just want to kill myself. I don't want to live anymore. And he said, Mommy, you will leave me too. And that's what broke the chain of suicidal ideation for me. To understand this kid, he's still my son. He still needed help. He still needed me. We actually needed each other. So with those words, I stopped thinking about suicide. And eventually, a few years later, um, we did get better. We started over all over again. We did get better. So yeah, but asthma is a family affair. It's not just, oh, your son has asthma. No, everyone has asthma. You're all involved. You're all a part of the team of trying to make sure that they get the best care, the best treatment at the best time. So I'm telling you, I've learned a lot from this last few years of Tony not being with me, and also for myself of being asthmatic and what to look out for, how to stay healthy and not avoid your triggers and all those things I have become almost an expert at since that time.
Now, Leonis, I mean, thank you for sharing such a powerful story.
Yeah.
And you have made Tony very proud.
Yeah.
And I wanted to delve a little now into how you're changing the world. I mean, all the beautiful things that you are doing now
Mhm.
and how you founded this foundation that is really trying to break down barriers that your family faced, that your son faced, that you yourself faced.
Yes. So eventually, it was maybe 6 or 7 years after Tony passed that I found the strength to honor him. And ironically, one of my coworkers, I work nights, she came by my job. I'm a critical care nurse. And we just started talking. You talk to me long enough, I'm going to talk about Tony at some point. And I told her, I said, I really want to honor him in some kind of way. And she suggested you start a foundation. I had no idea what that looked like. How do you do it? I had no idea what to do. I'm like, okay, cool. So I talked to my son about it, and we just got together with some friends, and we just started uh, trying to figure out how to go about starting the foundation. And I talked to a few people. Allergy Asthma Network was such a blessing to me as far as getting things off the ground. And here we are today. This is our 6th year. And it's such a blessing to be able. Last year we started 300 families. We're small, but we're mighty. We do great works. I'm going to pump my foundation up because it is absolutely the passion that I live for each and every day. And it also allows me to honor Tony in a big way. Honor Tony in a big way. So we provide, I'm also an asthma educator. I went back and got the certification, which I think I needed to be more effective and be more impactful in the space of asthma. So we do education. I do a lot of health fairs, and I had our own health fair last year where we had about 20 vendors at this health fair. It's very successful, and I was able to provide resources. What we do, we provide air purifiers, pillow mattress covers, spacers, nebulizers, all these things, and of course, extensive education all for free. So we get sponsorships. We do fundraisers, which is how we are able to do these things at no cost to the consumer.
That is wonderful work
Yeah.
that you're doing,
Mm-hmm.
Leonis. And it really, really talks about the actual turning something dark, a dark moment, into so much light.
Yeah.
And we have to thank you for everything that you're doing because it really resonates. And I think a lot of moms hearing us tonight are hearing your story. And what is one message that you would like to give these moms who might have a child who, like Tony, might have uncontrolled asthma?
There's a lot of things I could say, but I think the best and most important thing that I would tell mothers is to pay attention. Pay attention to your child. Know your child's moves and know what their triggers are. Tony was extremely quiet. You would have to almost. Are you sick, Tony? Like for real? But I knew when it was happening because he would get a runny nose. That was the first thing he would get. The coughing. I know that all those other symptoms, he had all those things, but the runny nose came first. I would say pay attention to your child. Do not sweep it under the rug. Don't think it's no big deal, or you'll be okay. Go sit down, take a break. No, ma'am, and no, sir. Pay attention. Every breath counts. Every breath counts.
Absolutely, absolutely.
Yes.
And I think that's a wonderful message to give parents. It's to
Hmm.
pay attention to their kids' symptoms because every kid is different. You're right.
Yeah.
Every asthmatic kid is very, very different.
Hmm.
Some percent non-coughers, they're just wheezers,
Yeah.
or some just cough, or it's only when they get a cold or where they
Hmm.
have a pet. Actually, I have to say, I have parents who says, I'm not getting rid of the dog, and the kid is completely reacting to the dog, and their asthma's worsening. And I said, we got to choose here. So I have to have sometimes these hard conversations. But this is why getting to a specialist early, I think, is one of the big messages that we want to send. And that's an allergist, an immunologist, or a pulmonologist, so we can get everyone under good control faster. And
Yes.
there's a lot of really wonderful advances now. And I love all the things that you're doing because you're right, education is key.
Hmm. Absolutely. I think without the education part of being an asthmatic or a caregiver, you kind of miss the point. You like you mentioned the parent with the dog or the parent with the cat, or you put the cat in the bed with the kid. And I have had so many conversations with mothers with children and pets, and mothers and kids who, oh, it's just an asthma attack. That that statement, I want to put up my dukes, okay? Because I'm like so angry when they say, oh, it's just asthma. No, if you can't breathe, nothing else matters. Nothing else matters. Or they'll say, I didn't know you could die from asthma. You can't breathe. You can't breathe. Where would that leave you? You can't breathe. So the education part is a big deal for me. I do a lot of education to parents and to different groups I've been a part of. And I just instituted or initiated a senior citizens arm of our foundation. So once a month, I just went yesterday to a senior citizens group. It was so good. It was very interactive, and I know I made a difference. And when I know
LAONIS,
I
can I
made a
tell you
difference,
that
yes,
Tony would be very proud?
yes, thank you.
Very, very proud of you.
Absolutely.
And where can people find out more about your foundation?
They can go to breatheajcfoundation.org. That is our website. They can go there and find what we've done so far. We have done a whole lot of education and our fundraiser. We're having a fundraiser July 18th. July 18th is our black tie fundraiser. Tickets are $75. If you're in the area, go to the website. The flyers on there. We have a bowling fundraiser this Saturday. Just go to our website. You'll see all the things that you can need to know about and what we're doing in the asthma space.
And you're in Michigan, correct?
We're in Michigan. Yes.
Excellent.
Hmm.
And now I think we can wrap up and take some key takeaways that we want to definitely give our public today and everyone listening.
Yes.
And one of the big things that I would tell them is one, to have an asthma action plan. Very important that they develop it with their pediatrician, with their primary care doc, with their allergist and immunologist or pulmonologist. Two, to answer the rules of two questionnaire, because it's so important that you know whether your asthma is under good control or not, whether it be your asthma or your child's asthma. Three,
Yes.
to seek an allergist, an immunologist, or pulmonologist if your asthma is not under good control. And to please visit www.controlyourasthma.org. So again, controlyourasthma.org for more information. And I think you'll find a lot of wonderful resources. And I'm going to hand it over to Pat.
Thank you both. My goodness, I wasn't expecting that story, Leonis.
Yeah.
First, my condolences
Thank you.
and my congratulations for
Thank
how
you.
you have turned this tragedy into a powerhouse statement to
Yeah.
counter, disparities in asthma.
Mhm.
Um, so powerful, so powerful.
Mhm.
And Dr. Mora, just the information you shared, so, simple but critical to making sure that folks are thinking about these things because it can be a deadly disease still. We have a few questions in the chat that I want to get to, but I had a couple of questions. I got to ask them. Um, Dr. Mora, you talked about the disparities that still exist. In your opinion, what do you think is working in countering some of the disparities that we see are still disproportionately impacting communities of color in the United States around asthma?
I think representation is key. So,
Mm,
as a Latina allergist, I love one being someone who comes from the same background. So, I'm humble first generation Mexican American. And so, when
mm,
patients come to me, and I knew what it was like to live in a small home. We were five kids, two parents, and a humble home who didn't have much, etc. And them seeing you from the same background, I understand the challenges. So, often when I have samples here in the office and I'll have samples of inhalers, etc., and I know a family is struggling, of course, if I have samples, I'm going to give them for free because
mm,
I'm trying to counteract those disparities as much as I can. And, any biologics, people go through losing their jobs, so time periods where they might not be able to get medication. So I kind of pull them through a little bit as well, too. And then
mm,
working with organizations like American Lung Association and the Allergy and Asthma Network. So important because we get to raise our voices, not only from a local level, but to a national level as well, too. We just spent actually 2 days on Capitol Hill with the Allergy and Asthma Network, specifically asking our lawmakers on a national level, one, to really medical insurance for all and affordable medications and really reaching these communities because we have to remind everyone deserves help. That's
Yeah.
not, it shouldn't be
exactly.
a gift. It
Yeah.
should be something that we all have.
We do fundamentally. Thank you for that. And
Mm-hmm.
Jonas, as your family was going through, I wrote this down. 2 times per week going to the emergency,
Mhm.
essentially the emergency room acting as your primary care provider.
Yes.
Um, how did you manage that stress, the pull on the family to manage all of that? Any words of
Mhm.
wisdom for our audience before I get to our audience Q&A?
With that, that's a good question because you have to have, to me, a strong family unit. You have to be
Mm,
on board. Everyone has to be on board um, with how things were going at that moment.
mhm,
And my youngest son would take time to. I work, like I said, I work nights, and we were all. It was all because family unit, all putting together, all for Tony. And I think Tony knew. He once told me, "I'm a burden to you, mommy." So when you hear those kind of things, you try to navigate even under the stress like that of trying to still do the right thing.
right,
Come on, you're not a burden. This is what we're going to do for right now. So it became a family affair. All of us, we all pitched in, and not one person had to carry the load alone. It wasn't just me. It was my husband. It was my youngest son. We all kind of pitched in. So that's how we were able to manage Tony's asthma all that time.
wow,
Yeah.
that's beautiful. The family
Mhm.
support I'm hearing
Mhm.
is that whole social support is so critically important
Yes.
to managing through
Mhm.
this type of crisis.
Yeah.
We do have some questions in the chat that I want to get to. One is my asthma is handled by my general practitioner, but is not under control. Should I go to an allergist or a pulmonologist? Great question.
Either or. So obviously, they're both wonderful specialists for asthma. So whichever you can get to and who's closest to you and will take your insurance, take them. So that way we can get your asthma under good control.
Okay.
Mhm.
And then the next question, how can parents help advocate for their child if they feel their asthma symptoms are being overlooked or undertreated?
Mhm.
Great point. What are your perspectives? Either of you on this? Leona, do you want to start?
Yeah, so this is what I did on behalf of Tony, and by me being an asthmatic myself, I understood the process and what it looks like to have an asthma attack. I think you just have to be vocal and speak up, especially in the school system, and making sure the teachers and the parents, everyone in Tony's school knew he had asthma. The janitor, the teachers, the gym teacher, the principal, I made sure everybody knew.
Hmm.
So it's important to have that kind of advocacy for yourself and also for your child. And that's how I made it, um, more doable for Tony to go to school. That I made sure that everybody knew that Tony had asthma and what
Hmm.
to do when he had an asthma attack. And my phone numbers were at with the teacher and the principal's office. They all had my phone numbers and my work number. I just try to make sure that everything that was possible, it was done in the school system.
Hmm. So the whole environment, you're making sure
Yes.
is aware
Hmm.
that he has this condition, so
Yeah.
people are prepared to respond if
Hmm.
he's in need. And Dr. Mora, from a physician standpoint, what advice would you give families and individual parents to advocate for themselves?
Sure. So if they feel like maybe their pediatrician is not listening to them, they can go to controlyourasthma.org,
Hmm.
circle the questionnaire, and then take it onto the pediatrician and say, look, I just done this
Mhm,
questionnaire and it seems like my child's asthma is not under good control. I think it's time to see an allergist, an immunologist, or a pulmonologist because I want to make sure that my child's asthma is under good control. And on a legislative side, talk to your lawmakers because we are also working on one nurse, one school, one nurse, so that
for
every
one nurse.
actual
Okay.
school has a school
Hmm.
nurse. Yes.
Hmm.
Wow, wow. So are you saying there's schools in the US that don't have a school nurse?
Yes,
Yes.
there's some that share one
Hmm.
school nurse between 5 schools. So
Yep.
that asthma attack is not going to wait for that school nurse to actually
Exactly.
be there.
Mhm.
That
Got
is
it.
so true. Oh,
Wow.
it's so true.
Mm. Um, so this is an interesting question, and I know you spoke to this, Dr. Moore, and some of the data you showed. The question is, why is it more active? Why is asthma more active in Black people? Is it more
Mm.
active, or is it that we're not getting treatment at the right time? Like which one is it?
Well, I
Or
think many factors. One is genetics. So definitely genetics play a role in asthma, and
Mhm.
African Americans have a higher rate of genetic predispositions toward asthma. Two,
Okay.
when we look at the quality of air that Black children live in, and even Latino children as well too, they're more likely to live in a community where the quality of air fails all three components of air quality, which is ozone, short-term particle pollution, and long-term particle pollution, which affects especially those little lungs that are still developing. And three, access to care, so that these kids don't really have access to allergists and immunologists or pulmonologists that are close or that maybe accept their insurance for many reasons for the Latino and the African American community. So
Mhm.
that's what we need to break down the barriers. One thing I forgot to mention for the allergy, for the College of Allergy and Immunology, and also for the American Academy of Allergy, this is the first year where our presidents are both African American women. And this
Wow.
is the first. Yes.
Sorry, had to do it. That's
Yes.
wonderful to hear. Because
That's how I
representation
felt too.
matters. That's what you started with. Representation matters.
Yes.
Mhm.
I think we can get one additional question in before we bring another surprise guest on. Um, Leonis, I think this would be for you. How do you
Okay.
get a very active 7-year-old? This might be taking you back a little bit to understand the importance of knowing when to tell mom he's not feeling well, particularly when outside playing.
That is a very good question, and it does take me back. You don't want to stop your kids from being active. That's number one. They're kids, they want to play outside, they want to do these things. But I would tell Tony, remember when you start coughing, or you have a runny nose, or you're running and you get tired, remember to stop.
Mm,
Remember to come home. Remember to ask, and I will always go, what's the magic word? Stop. Remember to stop.
Mhm.
And it worked. It worked, because eventually, they're out there running and playing. And sometimes kids just keep going. They know they don't
right.
feel well, but they don't want kids to know that they're sick. And so I had a really good rapport with the people on my block, the other moms. So they were all look out. It was kind of look out for Tony. Watch out for Tony.
Mhm,
He's in
mhm.
your yard. Make sure he's coming home. But I also would tell Tony, remember to stop. If you're not feeling well, to stop and to come home. But I also didn't let him go far, because you can't go far. You're trying to make it back home. You're not feeling well, so you could only go
Right.
like a couple hours down the street. So yeah, it's
Sure.
it's it's challenging, but it can be done.
A lot
Yeah.
of education, it sounds like,
Yes.
that's
Mm-hmm.
relevant for a 7-year-old,
Yes.
whatever the person's age is, the child's
Yes.
age may be.
Exactly.
Wow. I
Exactly.
could keep talking. I have so many questions, and I just want you guys to know the Q&A is blowing up. So we will get back to folks because we're not able to get to all the questions in this discussion, but we will plan to get back to folks and get your responses to them and communicate back out after the webinar. Thank you, thank you, thank you so much. It was such a pleasure to hear from both of you and get your advice and input. Thank you so much.
Thank you for
Uh,
having me.
Our pleasure. It was an honor to
Yes.
be here.
Thank
absolutely.
you so
Yeah.
much.
So, as we continue focusing on education and support resources, we're pleased to introduce the Allergy and Asthma Network. It's now my pleasure to introduce Linda Mitchell, the CEO of the Allergy and Asthma Network. I'll turn it over to you.
Well, thank you for having me. And Leonis and Dr. Moore are my favorite people. And you just did such a wonderful job just laying it all out and showing how important asthma control and asthma management is. And Leonis, you said education is key. And that's what I'm here to talk about. I'm here to talk about our free virtual asthma coaching program. It's a one-on-one 6-week program that's delivered by cell phone, by tablet, or by desktop, where you meet one-on-one with a certified asthma educator like LAONIS, and you learn about what good asthma control is. You'll learn about what triggers are. You'll learn about asthma action plans like Dr. MORA talked about. You'll learn about how to have a conversation with your doctor, how to recognize symptoms. It's a wonderful, wonderful program, and it's free. And we really want to just get the word out so that everyone who is interested in taking this course over a 6-week period, it really does make a difference. We collect data before people start the program and then how they are doing afterwards, and we find they use the ER less, they're feeling better, they're sleeping better, their quality of life is better, they're breathing easier. All the things you can think about is all because of asthma education that's delivered during these one-on-one sessions. There's no medicines prescribed. It's just you and an asthma coach learning how to manage your asthma better, because we go to doctors and we talk about our asthma, and then the rest of the time it's all asthma self-management. And so to learn about how to manage asthma is the key to keeping it under control. And with that, I know we're right about at the hour. I just wanted to just spread the word about it. It's asthmacoach.org, and you can fill out a simple form if you're interested, and we'll get back to you and talk to you about getting you involved in the program.
Thank you so much, Linda. Really appreciate your tips and emphasis on where to go for these critical resources. Thank you. Thank you so much for what you do. I want to also thank again our speakers and the stories. They're so important to making sure that what we're educating on today resonates and connects for people. Um, Thank you to our partners and all of those of you who joined today. Thank you for giving us this time. In particular, while you're filling out the survey, thank you to Sanofi Regeneron, our sponsors, and our community sponsor partners as well. Zeta, Alpha, Epsilon, Gamma Omega, AKA, Southern Crescent Black Nurses Association, and as Linda just presented, the Allergy and Asthma Network. Please, please, please fill out the survey. You should be able to scan this QR code and let us know, how did we do? Did this information help you? What are you going to do with it? There are a few questions that are built into this survey that will help us understand how to build this webinar series and other educational tools going forward to serve you as best possible. So thank you, thank you, thank you all for being here today. Really appreciate it, and wish you all a great evening wherever you may be. Thank you so much.